Here's how a brachytherapy implant is performed. A patient is taken into the operating room of the hospital. They're placed under anesthesia. Needles are placed perfectly around the prostate. Once the needles are in place, the implant is finished. These needles that are placed in the prostate will remain there for 1 day. During this 24-hour period, you will be taken to the radiation clinic 3 different times for a quick radiation treatment delivered through those implanted needles. You'll wake up after the operating room laying on your back in a hospital bed. At that point, we will take you into the X-ray department where we do a special CAT scan. A CT scan, also commonly called a CAT scan, takes a fancy X-ray image through your pelvis. The CT scan shows us where the prostate is, but also where the bladder is and the rectum is and the urinary tube that goes through the middle of the prostate. These are all very important normal parts of your body that need to be protected as we give a radiation treatment to the prostate in order to kill the cancer that's there. The images are then fed into our treatment planning computers, and we determine, based on these images, exactly which positions in your needles to send the radiation source to. The beauty of a temporary high-dose rate brachytherapy implant is that we can create any shape of radiation that we want around your prostate just by picking different positions and different lengths of time that we keep that radiation in your implant. For example, if we want to push the radiation out a little farther, like we might do where you have a little cancer nodule, then we keep the radiation longer at those nearby positions. If there's an area where we want to pull the radiation in, like we might do by your rectum, then we keep the radiation a little shorter at those nearby positions. But the point is that we can create any shape of radiation that we want just by determining where to send the radiation and how long we keep the radiation there. Some people ask the question, are you treating me to put my cancer in remission? And our answer to that is no, we are not treating you to put your cancer in remission. To me, remission implies that it's gone for a while, but it will probably come back. We treat people with the intent and the expectation that we will totally eradicate, completely cure the cancer. It is completely gone.